If bone spur surgery is so effective, why do they come back? Doctors rarely ask why your body built a spur in the first place, but that's the real way and journey to recovery. So in this video, I will show you what most doctors miss and what actually works if you want to recover naturally. You've done everything that they told you to do. The cortisone injections, orthotics, pain pills, physical therapy, but the pain is still there. And the spur is actually still there too as well. And then now they're telling you that the next step is surgery. Now let me tell you something that may surprise you. Your doctor isn't lying to you, but they also aren't giving you the whole truth because they simply don't know what else to offer. They're treating the pain and not the root cause. So here's what typically happens. You show up with heel pain, foot pain, back pain. They give you pills or cortisone, injections to try to numb it. You may get some custom orthotics. Maybe you get a round of physical therapy. And if you're still hurting after 6 months, then they start pushing for the surgery. Okay, that's your standard model. But it's focused on symptom control, not solving the root issue, and definitely not preventing it from coming back. So understand though, we're not just talking about foot spurs, we're talking about overcalcification problems in general. So this applies to spurs in your Achilles area, stenosis in your spine, dish, and you know what dish is if you have it, okay? So the pain is not going to improve if the source of the pain and the source of the spurring is not addressed. In the clinic recently, I had a patient who just was sharing that he was going to get his carpal tunnel surgery done on the right hand side the following week. And I was doing right now. We're seeing him for his left shoulder, and he said, "Oh, he did the physical therapy, and nothing helped him." And I'm thinking, nothing helped him. Okay, I've heard this before. So I just literally just all I had him do is I had him show me his range of motion. And when I saw the range of motion and I pushed on it a little bit, I kind of like inside just shrugged because I knew that everything had not been done that could be done. And I want to tell you guys, I'm so weary of people's bodies being butchered when it doesn't have to be. But people don't know. They don't know any other way. And so again, I want to prevent you from doing something unnecessary because when I hear people say nothing has helped and the things that they're doing are the things I just discussed with you, it makes me cringe inside. And I immediately can know why things may not be working. Some pain medications, they just mask symptoms. They don't dissolve calcium. They just block the signals that your body's sending out. And then if you're using things like orthotic supports or back braces, it's kind of like putting a pillow under something that's weak, a weak deck or something like that, and thinking that's going to support it. The issue is with the quality of the wood itself. It doesn't make a difference how much support on it. It's still going to be a problem. So when you're using support for your foot, for your back, again, it's not rebuilding the tissues, not rebuilding the bone. They're not changing the tight tissues that are around the area. And then it's not changing and restoring mineral balances. And then if you have surgery, it cuts the spur out, that's for sure. Okay. But it doesn't address why your body created that area like that in the very first place. So what happens? You can end up with new pain. You can end up with very difficult recovery and never quite being able to move the way you were doing prior to all your problems starting. But you can also have new spurring. And I see this with back surgeries where they take out an area of the bone or they try to clean something out. But then when they've gone through the recovery, within, I'll say 3 to 5 years, they're starting to have symptoms again. And then if they at that 5 year mark or so, what I have seen is that they get another imaging done, some more imaging done, and they find that they have stenosis on the area above. And that's why they had the surgery in the first place. So it's because, again, it's not addressing why people are getting the spurring. And I've had patients that come in and they're trying to avoid, because the hurt that they're having, they're under, right? And so they're walking, like one lady was walking on the outside edge of her feet because she's just trying to avoid beating on that area. She had orthotics as well, but she had just developed this habit because she's trying to protect herself. And so the orthotics really still weren't really working for her. And so what's happened is that she's developed an area on the outside of her ankle. The peroneals are overstretched, and that's going to make them weak. And then her inverters of her ankle are going to be shortened, and they're going to be tight, and they're still going to be weak. And so all that contributes to that pain really not subsiding. And so I guess what I'm trying to explain is that we can't just support weak structures, because it usually makes them weaker. And then when things don't work properly, the neighboring tissues start to become involved, because your body wants to keep you upright and mobile. And when you can't use an area properly, you start putting more pressure on another area, but then it's going to end up leading to what starts out as a foot problem becomes a knee problem, hip problem, back problem. What starts as a shoulder problem becomes a neck, mid back, hip problem. So it just kind of, everything is kind of operates in a continuum. So what's missing in this whole approach to dealing with bone spurs? Because bone spurs, really, they're not just random growths. You know, I try to communicate that if you look at how many people spend their workday walking on concrete floors, okay, everybody doesn't get bone spurs. People think it's from, wearing certain shoes, being on your feet certain number of hours a day. And sometimes, they may think it's the weight that could contribute, but everybody doesn't get bone spurs. So what's happening is your body is responding to years of tension, poor circulation, chronic inflammation. And here's what most people and most physicians miss. It's linked to changes in the acidity. If you are acidic in your pH levels of your body, okay, you're more prone to have problems with spurring. And then there's imbalances. Our body is about equilibrium. It likes to keep things in balance. And when you are not getting enough calcium and silica or magnesium, these imbalances in your minerals throw things off in your bone health. And then there's tight muscles. You're not getting good blood flow, and you might not getting things draining out of your system like they should. But then there's also things like stress, and we're talking about physical stress, emotional stress, chemical stress. I've seen it. I've seen people flare and develop problems, and it's like the body is very interesting, but the mind and the body are very, very intimately connected. So that is why you can't just cut out a spur or cushion it and then expect it to just fully recover. It has to be addressed differently. And I'm not saying that there's some people who haven't had surgery and who have had surgery and they've been able to recover fully. But when I do meet people and I get follow-up care, and I'm giving follow-up care to people, and I see what they have to deal with on the other side, knowing that they have not corrected the problem that started in the first place, it's just setting them up for future issues. And typically, when you do any kind of surgical repair on top of a body that is already compromised with some of the things I just talked about, they're going to have a harder time recuperating. So, do I have permission to propose an alternative approach? Can we really look at how you can recover looking from the inside and from the outside? Because I do treat these conditions differently. I support an approach that instead of like numbing it, we look at rebuilding it. And so I have protocols that focus on the internal terrain of the body. And so I use different tools, nutrient dense foods, and things like teas. I use things that are going to boost the nutrition of the body. and things that are going to support calcium metabolism and to reduce the inflammation. And then there's some topical therapy type things that are very good for reducing pain levels, also addressing calcium, and to just soften tissues, and that's applied externally. But then you do have to combine this with proper movement because it's critical for recovery of tissue. And it can't be just any kind of stretch, you know. You have to make sure you're making sure your calf muscles are in shape all the way up to your hip if you're dealing with something with a foot. If it's something with your back, you got to do the core. You got to do the hips themselves. All of these things are connected, but basically, we want to look at using supportive mobility in order to reset the mechanics of your whole body. And so, this is the foundation of my overcalcification protocol, and it works because it works with your body and not against it. So if you are tired of chasing pain, your pain from your spurs with pills, and if you are really wanting to be more proactive and you're ready for a different approach and you realize that let's not cut. Don't cut, rebuild. Well, for someone like you, I have put together a free guide, the Bone Spur Fix, and that walks you through some of the exact steps that you want to implement that can help you to start to reduce your pain levels and start to address this spurring in more natural ways. And you're going to learn a little bit about what to eat, what to avoid, and a few natural strategies that can actually get you started and rolling and going down the path of recovery. Now, but I have to understand that everybody is at different points. But if you are someone who just at least wants to get the information, get some education, I do want you to check out the Bone Spur Fix. It is a free guide, and you can find the link in the descriptor. I did have someone I wanted to share it, and this customer was saying that I had pain in my right foot for about a year and was diagnosed as having a heel spur, and it was very, very painful when I did any walking. And I received treatment from a foot doctor, but nothing helped. Then I tried the Diasi salve for heel spurs following the instructions given me. And after 2 weeks, there was no more pain. And after more than a year, I still do not have any pain. So I highly recommend this product. Now, I will tell you, with this particular customer, this is someone I knew about a little bit about their background. And so when you have someone who's coming from a relative, he had done everything he knew to do. He corrected everything he knew to correct, but he was still having problems. So his response is pretty rapid. But there's other people who they haven't made some of the dietary changes that this gentleman had made. And so their response takes a longer amount of time because, hard habits, bad habits are hard to break. We're kind of like slaves to our taste buds. But again, you do things so that you can recover. And I think once you make changes, you're going to kind of want to stick to some things that are going to just keep you feeling good. So, just with the understanding that it's not easy to change the way you manage your health. And I understand information is great, and some of you can get the guide and take it and run. Okay. But transformation, if you really are looking for transformation, it's going to take support. And so that's why I created the Wellness Reclaimed community. And this is a private space for action takers. This is for people who are done with settling for temporary relief and who are ready to rebuild their health using natural proven strategies. And so it's not open to the public. And I won't just let anyone in. I don't just let anyone in. This is not a space for endless venting and for excuse making. This is for people who are ready to do the work, to take ownership of their wellness, and to get the support that they actually need. So if that sounds like something like that fits you and you're ready to reclaim your health with the accountability, with coaching and clarity that you've been missing, then you can request to join the wait list and just use the link in this descriptor. And so check that out. But either way, if you are wanting some answers to why you're having some of the problems you're having with the spurring, I know I did not share with you maybe something you expected to hear, but I know that Inflammation is a big part of this problem. A lot of you are in a lot of pain, and if you even get the a guide, it'll show you a number one technique that I like people to use to start getting that inflammation to calm down. You may not adopt the whole principles that I outlined, but I will tell you it's better than what's out there. And so this is Adina, and I am signing off, letting you know I am dedicated to restoring your health.